Hello, driving theory test students. Do you know DVSA bus and coach PCV license theory test, accident handling? Let's go. Question 1. You've stopped at the scene of an incident where there are casualties. What should you do to help while waiting for the emergency services to arrive? A. Keep injured people warm and comfortable. B. Clear debris from the road. C. Keep injured people on the move by walking them around. D. Give injured people a warm drink. The correct answer is A. If you stop to give help at an incident and there are casualties, don't move injured people unless there's further danger. Keep them warm, comfortable and calm. Don't give them anything to drink. Question 2. There's been an incident. What can you do to help a driver who's suffering from shock? A. Give them a drink. B. Offer them a cigarette. C. Ask who caused the collision. D. Reassure them confidently. The correct answer is D. You can help someone suffering from shock by talking to them and reassuring them confidently. Don't leave them alone or give them anything to eat or drink. Question 3. You're at the scene of a collision. People are injured. What should be done when the risk of further collisions has been dealt with? A. Pull people who are hurt out of their vehicles. B. Clear a parking area for the emergency services. C. Make sure the emergency services have been called. D. Get the casualties to drink something sweet. The correct answer is C. Make sure you or someone else has called the emergency services. Check the casualties and, if you feel able to give first aid, do so. Alternatively, ask any bystanders if they can help. Question 4. What should you do before driving into a tunnel? A. Switch off your radio. B. Remove your sunglasses. C. Close your sunroof. D. Switch on your windscreen wipers. The correct answer is B. Before driving into a tunnel, you should take off your sunglasses. If you don't, you'll find that your vision is restricted, even in a tunnel that appears to be well lit. Question 5. You're trying to resuscitate a casualty who isn't breathing. For how long should you continue compressions if they haven't started breathing again? A. Give up if you think they're dead. B. Keep trying for up to 2 minutes. C. Until medical help arrives and takes over. D. Keep trying for up to 4 minutes. The correct answer is C. If you're trying to resuscitate someone, it's important that you don't give up on them. Make sure that someone has called the emergency services and continue trying to resuscitate the casualty until a medical professional takes over. Question 6. You're waiting for the emergency services to arrive at the scene of an incident. A pedestrian's leg is bleeding heavily, but there's nothing embedded in the wound. What could you do to help? A. Apply firm pressure to the wound. B. Dab the wound to stop the bleeding. C. Put the casualty into the recovery position. D. Wrap an ice pack near the wound. The correct answer is A. Before helping the pedestrian, you should protect yourself from contact with blood. If there's nothing embedded in the wound, you can stem the flow of blood by applying pressure to the wound area. As soon as practical, fasten a pad to the wound with a bandage or cloth. Question 7. At the scene of a crash, a casualty is in contact with live electrical cables. What should you use to break the electrical connection? A. A metal pole. B. Woolen gloves. C. A damp piece of cloth. D. A length of wood. The correct answer is D. At the scene of an incident, if there are any casualties who are in contact with live electricity, don't touch them with your hands, even if you're wearing gloves. You should use a dry, non-conducting item, such as a wooden sweeping brush or plastic spade. You mustn't give first aid until you're sure the electrical contact has been broken, otherwise you'll be putting yourself in danger. Question 8. You're stopped by a police officer for a suspected motoring offence. Which document will you always be asked to produce? A. Your driving licence. B. Your vehicle registration document. C. Your vehicle's MOT certificate. D. Your theory test certificate. The correct answer is A. If you can't produce your driving licence when asked to do so by a police officer, you may be asked to produce it at a police station within a certain time. Question 9. You're at the scene of an incident. How can you help someone suffering from shock? A. Reassure them confidently. B. Offer them a cigarette. C. Keep them moving. D. Give them a warm drink. The correct answer is A. Immediate treatment can help to reduce the effects of shock. Reassure the casualty and try to keep them warm and comfortable. Only move a casualty if it's necessary for their safety. Question 10. A vehicle has rolled over and caught fire. The driver's hands and arms have been burned. How could you help the driver? A. Douse the burns with cool water. B. Try to put out the fire. C. Remove smouldering clothing. D. Remove anything sticking to the burns. The correct answer is A. Don't remove anything sticking to a burn. You may cause further damage and introduce infection into the wound. If you can, douse the burn with clean, cool water for at least 20 minutes. Question 11. You arrive at the scene of an incident where a motorcyclist is lying in the middle of the road and unconscious. What's the first thing you should do? A. Move the rider out of the road. B. Warn other traffic. C. Clear the road of debris. D. Give the rider reassurance. The correct answer is B. At the scene of an incident, the first priority is to prevent any further collisions by warning traffic. You can warn other traffic by switching on hazard warning lights or displaying an advance warning triangle, or by any other appropriate means. Question 12. You arrive at an incident where a motorcyclist is lying in the road, unconscious and bleeding. The area is safe and the emergency services have been called. What's the first priority when checking the rider? A. Remove their helmet. B. Stop the bleeding. C. Check their airway is open. D. Move them off the road. The correct answer is C. At a traffic incident, the danger of further collisions and fire needs to be dealt with, and the emergency services must be called. When helping a casualty, follow the DRABC procedure, as this has been designed by medical experts to give the best outcome while waiting for the emergency services to arrive. Don't remove a motorcyclist's helmet unless it's essential to do so. Question 13. You're at an incident. Why may it be harmful to move a casualty? A. You could damage your back. B. You could get blood on your hands. C. You could be accused of assault. D. You could cause more injury. The correct answer is D. Be especially careful about moving casualties at the scene of an incident. Inexperienced handling of a casualty could cause more injury or even prove to be fatal. Only move casualties if they're in danger, for example, from fire. Question 14. The area around an incident is safe. What's the best way to help an injured person? A. Get them out of their vehicle. B. Give them a drink. C. Give them something to eat. D. Keep them in the vehicle. The correct answer is D. Don't move a casualty who's in a safe place, as this could worsen any injury they may have. Only move a casualty if they're in danger, for example, from passing traffic. You may also need to move them if you need to give life-saving first aid, such as opening their airway. Question 15. Your vehicle is involved in an incident where someone is injured. You don't produce your insurance certificate at the time. How soon must you report the incident to the police? A. 24 hours. B. 48 hours. C. 72 hours. D. 7 days. The correct answer is A. If you don't give your name and address at the time of an incident, report it to the police as soon as you can, or in any case within 24 hours. If any other person is injured and you don't produce your insurance certificate to the police at the time of the incident, or to any other person who has reasonable grounds to request it, you must also report the incident to the police as soon as possible, or in any case within 24 hours. Produce your insurance certificate to the police either when reporting the incident or within 7 days, 5 days in Northern Ireland, at any police station. Question 16. You're at the scene of an incident. What would suggest someone is suffering from shock? A. A flushed complexion. B. Being alert. C. Rapid shallow breathing. D. Being very hungry. The correct answer is C. The effects of shock may not be immediately obvious. Try to recognize the warning signs early. Prompt treatment can help to deal with it. Symptoms include a rapid pulse, pale grey skin, sweating and rapid shallow breathing. Question 17. What should you do before entering a tunnel? A. Put on your sunglasses. B. Check your tyre pressures. C. Change to a lower gear. D. Tune your radio to a local channel. The correct answer is D. On the approach to many tunnels, a board will indicate a local channel or radio frequency that you should tune into. This should give a warning of any incident or congestion in the tunnel ahead. Severe loss of life has occurred in tunnel fires. Getting advance warning of any problems ahead will help you to take appropriate action in good time. Question 18. Your vehicle catches fire while you're driving through a tunnel. What should you do if the vehicle can still be driven? A. Leave it where it is with the engine running. B. Stop, then walk to an emergency telephone point. C. Park it away from the carriageway. D. Drive it out of the tunnel if you can do so. The correct answer is D. If it's possible and you can do so without causing further danger, it's safer to drive a vehicle that's on fire out of a tunnel. The greatest danger in a tunnel fire is smoke and suffocation. Question 19. You've had an incident while driving through a tunnel. You aren't injured, but your vehicle can't be driven. What's the first thing you should do in this situation? A. Rely on other drivers to phone the police. B. Switch off the engine and switch on hazard warning lights. C. Take the names of witnesses and other drivers. D. Sweep up any debris that's in the road. The correct answer is B. If you're involved in an incident in a tunnel, be aware of the danger this can cause to other traffic. You should immediately switch on your hazard warning lights and switch off your engine. Question 20. When should you stop trying to resuscitate a casualty? A. When you think they're dead. B. When they can breathe without help. C. When they've turned blue. D. When you think the ambulance is coming. The correct answer is B. If you're trying to resuscitate a casualty, don't give up until a medical professional takes over. Never assume that someone's dead. People who aren't breathing can survive longer than you may imagine when given CPR. Question 21. While driving through a tunnel, your vehicle catches fire. What's the first thing you should do if the vehicle can't be driven out of the tunnel? A. Wait for the police. Tunnels are regularly patrolled. B. Stay with your vehicle. You'll be seen by the CCTV cameras. C. Stop at the side of the road and switch off the engine. D. Don't put out the fire. Wait for the emergency services. The correct answer is C. If your vehicle catches fire in a tunnel and it can't be driven, stop on the side of the road, as far away from passing traffic as possible. Turn off the engine and warn other traffic by switching on your hazard warning lights. Question 22. At an incident, a casualty has stopped breathing. How could you help them? A. By opening their airway. B. By tilting their head as far forward as possible. C. By raising their legs. D. By giving them something to drink. The correct answer is A. To help a casualty who isn't breathing, you should open their airway by placing your fingers under their chin and lifting it forward. This will open their airway, but if there are no signs of breathing, you should then start CPR. Question 23. Where should you stand when using a motorway emergency telephone? A. In front of the barrier. B. Facing the oncoming traffic. C. With your back to the traffic. D. Looking towards the grass verge. The correct answer is B. Motorway phones are free and easily located. You should face the oncoming traffic while using them so that you can see approaching vehicles. Question 24. What should you do when you drive into a tunnel? A. Use parking lights. B. Use front spotlights. C. Use dipped headlights. D. Use rear fog lights. The correct answer is C. Before entering a tunnel, you should switch on your dipped headlights. These help you to see and be seen. In many tunnels, using headlights is a legal requirement. You should also remove your sunglasses before you drive into a tunnel. Question 25. What's the first thing you should try to do if your vehicle catches fire while you're driving through a tunnel? A. Drive out of the tunnel. B. Stop at the side of the tunnel. C. Stop and put out the fire. D. Stop and leave the vehicle immediately. The correct answer is A. If your vehicle catches fire in a tunnel, you should first try to drive it out, but only if you can do so safely. Question 26. At the scene of an incident, a person has become hysterical. How should you calm them down? A. By leaving them to quietly recover. B. By engaging them in banter. C. By giving them a hot drink. D. By talking to them quietly and firmly. The correct answer is D. Someone who has been involved in or witnessed a crash will be in no mood for humour. The best way to calm them is by remaining calm yourself and talking quietly and firmly to them. Question 27. You're approaching a bridge that has no height restriction on it. What's the minimum height under the bridge? A. 3.6 metres, 11 feet 10 inches. B. 3.6 metres, 11 feet 10 inches. C. 4.8 metres, 16 feet. D. 5 metres, 16 feet 6 inches. The correct answer is D. The headroom under bridges in the UK is at least 5 metres, 16 feet 6 inches, unless otherwise stated. Where the overhead clearance is arched, this headroom is normally only between the limits marked. Question 28. You arrive at the scene of an incident. A casualty has an injured arm that's bleeding heavily. What could you do to help while waiting for the emergency services to arrive? A. Remove clothing around the wound. B. Dab the wound. C. Get them a drink. D. Try to stem the flow of blood. The correct answer is D. You should first protect yourself from exposure to blood. Many first aid kits contain surgical gloves. To stem the flow of blood, you should apply firm pressure over the wound. If there's an object in the wound, you'll need to build up padding on either side and make sure you don't press on the object. Question 29. At the scene of an incident, an injured person is lying in a busy road. What's the first thing you should do to help? A. Treat the person for shock. B. Warn other traffic. C. Place them in the recovery position. D. Make sure the injured person is kept warm. The correct answer is B. You should warn other road users that there has been an incident. You can do this by displaying an advance warning triangle or by switching on hazard warning lights or other lights. However you choose to warn people of the incident, make sure it doesn't put you or others at risk. Question 30. What should you do when you're driving through a tunnel in heavy traffic? A. Stay close to the vehicle in front to reduce congestion. B. Switch off your dipped headlights to reduce dazzle. C. Closely follow the tail lights of other vehicles. D. Follow the instructions given by variable message signs. The correct answer is D. In congested tunnels, you should always obey the instructions given by variable message signs and tunnel officials. Listen out for radio announcements and observe the road signs and signals. Keep your distance from the vehicle in front. Question 31. You arrive at the scene of an incident. How should you deal with someone who is hysterical? A. Talk to them quietly and firmly. B. Let them wander off to calm down. C. Restrain them physically. D. Shout loudly to get their attention. The correct answer is A. A person who's hysterical may do things that you wouldn't expect. Try to keep the distressed person calm and safe until the emergency services arrive. Question 32. You arrive at the scene of an incident and someone is unconscious. What's the first thing you should do to help them? A. Take the numbers of the vehicles involved. B. Try to get them to drink water. C. Check that they're breathing. D. Look for any witnesses. The correct answer is C. The priority when dealing with an unconscious person is to make sure their airway is open and they can breathe. Stay with the casualty and make sure someone rings for an ambulance. Question 33. You're driving through a congested tunnel. What should you do if you have to stop? A. Stop very close to the vehicle in front to save space. B. Ignore any message signs as they're never up to date. C. Keep a safe distance from the vehicle in front. D. Put your headlights on full beam. The correct answer is C. It's important to keep a safe distance from the vehicle in front at all times. This still applies in congested tunnels, even if you're moving very slowly or have stopped. If the vehicle in front breaks down, you may need room to maneuver past it. In question 34, what should you do if you're the first person to arrive at the scene of an incident? A. Warn other traffic to prevent further collisions. B. Take photographs of the scene. C. Offer a calming cigarette to those involved. D. Ask everyone who isn't injured to leave. The correct answer is A. Warn other traffic of the incident without putting yourself or others at risk. Once the danger of further collisions is dealt with, call the emergency services. While you're waiting for them to arrive, keeping casualties or witnesses calm is important, but never offer a cigarette because of the risk of fire. Question 35. What must you do if you're involved in a traffic incident? A. Drive on for help. B. Inform the police within 7 days. C. Stop at the scene. D. Drive to the nearest police station. The correct answer is C. If your vehicle is involved in a traffic incident, you must stop. Follow the guidance set out in the Highway Code if there's injury or damage to any other person, vehicle or property. Question 36. You're the first person to arrive at an incident where people are badly injured. What's the first thing you should do? A. Switch on your own hazard warning lights. B. Contact the local radio station to tell them about the incident. C. Try and get people who are injured to drink something. D. Move the people who are injured clear of their vehicles. The correct answer is A. If you're the first to arrive at an incident, further collisions and fire are the immediate concerns. Switch on your hazard warning lights to warn other traffic. Stop any running vehicle engines to reduce the risk of fire. Don't assume that someone else has called the emergency services. Do it yourself. Don't move casualties trapped in vehicles unless they're in danger. Question 37. You're driving through a tunnel. What should you do if your vehicle breaks down? A. Switch on hazard warning lights. B. Remain in your vehicle. C. Wait for the police to find you. D. Rely on CCTV cameras seeing you. The correct answer is A. If your vehicle breaks down in a tunnel, it could present a danger to other traffic. First, switch on your hazard warning lights. If there are passengers in your vehicle, take them to the nearest exit point. You should then call for help from an emergency telephone. Don't rely on being found by the police or being seen by a CCTV camera. The longer a vehicle stays in an exposed position, the more danger it poses to other traffic. Question 38. At an incident, you suspect a casualty has back injuries. What's the best way to help them? A. Offer them a drink. B. Leave them where they are. C. Raise their legs. D. Offer them a cigarette. The correct answer is B. If you attempt to move a casualty who has a spinal injury, it could cause further damage. Make sure an ambulance has been called for and talk to the casualty to keep them calm. Question 39. You've been involved in an incident and damaged some property. What should you do if nobody else is present and your vehicle is still roadworthy? A. Stop. Then report the incident to the police within 24 hours. B. Leave the scene. Don't report the incident if there are no witnesses. C. Stop. Then report the incident to the police after 48 hours. D. Leave the scene. Don't report the incident if there were no injuries. The correct answer is A. If you're involved in an incident that causes damage or injury to a person or property, you must stop. You must also give your details to anyone who has reasonable grounds to ask for them. If you don't do this, you must inform the police as soon as possible and in any case within 24 hours. Question 40. Your engine catches fire. What should you do before attempting to put the fire out? A. Shut off the fuel supply. B. Open the engine housing wide. C. Drive to the nearest fire station. D. Empty the air tanks. The correct answer is A. An engine fire is serious. If the fire breaches the fuel lines, it can easily spread to the fuel tank. If that happens, both the vehicle and its cargo will probably be lost. Therefore, your priority is to shut off the fuel supply. Question 41. You arrive at an incident where someone is suffering from severe burns. What should you do to help? A. Douse the burns with cool water. B. Remove anything stuck to the burns. C. Burst blisters that form on the burns. D. Apply ointment to the burns. The correct answer is A. Clean, cool water will cool the burning tissue and help prevent further damage. It will also reduce swelling, minimize shock, and alleviate pain. Question 42. At an incident, a casualty is unconscious but still breathing. Why would you move them? A. Because an ambulance is on the way. B. Because bystanders advise you to. C. Because there's further danger. D. Because they look uncomfortable. The correct answer is C. Moving a casualty could cause further injury, so it's important that this is only done if there's danger to them where they are. Question 43. You're at the scene of an incident. What does it mean if there's a plain orange rectangle displayed on one of the vehicles? A. It's carrying dangerous goods. B. It's carrying a first aid kit. C. It's carrying medical supplies. D. It's unladen. The correct answer is A. Vehicles that carry dangerous goods have badges displayed on the side and rear. The badges are orange and show the type of material that's being carried. Make a note of this and report it to the emergency services when you contact them. Question 44. You arrive at the scene of an incident where someone is injured. What should be given urgent priority? A. Deal with the danger from further collisions or fire. B. Get the casualty a warm drink. C. Take details of any witnesses. D. Take the numbers of the vehicles involved. The correct answer is A. Make the area safe and call the emergency services first. If you're able to give first aid, follow the DRABC procedure. If you feel you aren't capable of carrying out first aid, consider taking some training. It could save a life. Question 45. Your vehicle breaks down on a motorway. What should you do if you can't get it fully onto the hard shoulder? A. Stand at the edge of the carriageway to warn others. B. Place a warning triangle in the lane behind your vehicle. C. Wear a bright jacket and stand in the lane behind your vehicle. D. Call for help using the nearest emergency telephone. The correct answer is D. Standing on or near the edge of the carriageway is very dangerous. Your priority is to alert the emergency services by using an emergency roadside telephone. This connects to an operator who'll get help out to you as soon as possible. In most cases, this is preferable to using a mobile phone, as it will show the operator your precise location. Question 46. You're at the scene of a traffic incident. What are the symptoms of someone suffering from shock? A. Rapid pulse and sweating. B. Flushed complexion and deep breathing. C. Slow pulse and dry skin. D. Muscle spasms and an itchy rash. The correct answer is A. Prompt treatment can help to deal with shock. Warning signs to look for include rapid pulse, sweating, pale grey skin, and rapid shallow breathing. While waiting for help to arrive, keep the casualty warm and comfortable, and speak reassuringly to them. Question 47. Which type of fire extinguisher shouldn't be used on flammable liquids? A. Water, red. B. Foam, cream. C. Dry powder, blue. D. Carbon dioxide, black. The correct answer is A. It's very important to know the correct fire extinguisher to use. They'll carry a coloured label or badge telling you their contents. Make sure you learn which extinguisher is which, as using the wrong one could be dangerous and may spread the fire further. For example, you should never use a water extinguisher on burning oil. Question 48. You arrive at the scene of an incident. The emergency services have already been called. A pedestrian is bleeding heavily from a leg wound, but their leg isn't broken. What could you do to help them? A. Dab the wound to stop the bleeding. B. Give them some painkiller tablets. C. Apply firm pressure to the wound. D. Fetch them a warm drink. The correct answer is C. You should first protect yourself from exposure to blood. Many first aid kits contain surgical gloves. To stem the flow of blood, you should apply firm pressure over the wound. If there's an object stuck in the wound, you should leave it in place and build up padding on either side, making sure you don't press on the object.